Today's Health Watch, we take a look at Bridges to Recovery, a residential treatment facility that gives individuals the opportunity to receive mental health and behavioural health treatment in ultra-luxurious residential facilities rather than a traditional hospital. With us today is the clinical director and psychologist at Bridges to Recovery, Dr. Trevor Small. Dr. Small, great to have you.
Thank you so much for having me today.
Well, let's jump right in, shall we, and tell us a little bit about Bridges to Recovery.
Bridges to Recovery is a private psychiatric facility located in 3 separate luxurious locations that provides supportive and comforting care to people struggling with mental health issues.
Now, it seems like these residential treatment centres have been all the rage in recent years. Are there benefits to receiving mental health treatment in a residential facility as opposed to a hospital?
Residential programs provide an individual with the opportunity to grow and feel supported in a small, structured environment to help them to have the individualized care that they need to understand why it is that they are where they are and how to reach those goals and dreams that they never thought they could attain.
Bridges to Recovery is known as a high-end private residential treatment centre. So what sets you apart from other programs?
It really goes to the level of care that's provided to the people that come to us for help. Our therapists, experts in the field, are all at the doctoral level, board-certified psychiatrists, people that have been practicing for 20, 30 years in understanding exactly the needs of the person sitting with them in the room and how to help them get to where they need to go.
Bridges to Recovery is fully licensed, but I hear that's not the case with many other residential treatment facilities. Is that right?
The state of California has very stringent criteria as to what they determine to be the highest standards of care. Our program meets not only their requirements, but also the requirements of many different agencies in providing the highest level of individualized residential care to those people struggling with mental health issues.
And does Bridges to Recovery deal in only mental and behavioural health issues, or do you treat things like addiction as well?
Addiction of all kind, impulses, problems with gambling, drugs, pornography, problems with impulse that we think about as addiction are those things that we can help people understand as ways of managing the problems and concerns that they found to be unmanageable.
It seems like every time you turn on the TV nowadays, there's another tragic story that involves someone suffering from a mental health issue that was either misdiagnosed or didn't receive the proper treatment. Do you think that these publicized acts of violence have placed more of a cultural awareness on mental health issues over the past few years?
Let's be honest, the system is broken. Regrettably, tragedies occur when people don't get the help that they need. In the United States, 1 out of 4 Americans suffers with a diagnosable mental health issue. At Bridges to Recovery, what we try to do is not only provide an awareness to the individual coming to us for help, but we try to provide an education about mental health and its treatment to the family members and the loved ones of the people who have been brought to us.
Many mental health issues seem to go untreated. Do you have any estimation on how many people are actually suffering from mental health issues in this country? And would the number shock most Americans?
The number is staggering. 1 in 4 Americans struggle with a diagnosable mental health issue within a 12-month period. That's millions and millions of Americans, and regrettably, the mental health system isn't set up for that number of people.
Now, we all know that men and women go about things very differently, but who is more likely to seek treatment for mental health issues?
Men and women come into treatment in different paths. I oftentimes find that women that will present will say that they have been speaking to everyone around them and they've received a lot of feedback that says, listen, it's time to get more help. Men, on the other hand, often say that they've shared their struggles and suffering with no one, and it's really come to their attention that they needed more help when someone finally confronted them, that they noticed that they were either more irritable, more isolated, turning to substances, those sorts of maladaptive coping as a way of dealing with emotions that they weren't able to deal with.
And why are men less likely to seek treatment?
In the United States, as a culture, one thing that we teach to younger children especially to males, is to suck it up. For example, a child loses a hockey game, the child begins to cry, the coach comes over and says, "Hey, stop crying, suck it up." That's the lesson that we teach to boys, to young men. Don't display emotion. Don't display vulnerability. Women display vulnerability. Culturally, this is what's emphasized in media, in print, movies. One thing, however, is that we're all human beings. Men need to express emotion. Men need to know that it's okay to be vulnerable, that it's okay to be sad, to be anxious, to be nervous, to be whatever it is that they're struggling with, and that using their words, reaching out to those that they need around them to ask them for help, those are the ways to grow, not internalizing, not turning to drugs and alcohol, pornography, gambling. That's what we try to teach.
Many of the stories in the news about mental health seem to involve young people in their 20s and 30s. Why is that?
One of the things that we find at Bridges to Recovery is young people that come in for treatment are often those that are making a big bang in their lives. They're displaying their anxiety, their sadness, their trauma symptoms through driving recklessly, getting into trouble, destroying property, destroying their lives. Younger people say, "Help me," in a way that people notice. We find that older adults suffering with mental health issues will typically pull back, withdraw, isolate. So reaching those two different age demographics might look slightly different. However, in treating them, it's a similar plan. Help them to identify the problem, help them to understand ways to fix it, and help them to implement those ways in their life to reach their goals and dreams.
Well, let's take a patient who is suffering, for example, from bipolar disorder or trauma issues. How would spending 30 days at Bridges to Recovery change their life?
Most people that go to a psychologist, to a psychiatrist, they see their psychologist or psychiatrist once, maybe twice a week. They show some improvement in addressing the symptoms that they went to fix. At Bridges to Recovery, what we do is we provide a small, individualized, private environment where people can grow in 30 days and receive more mental health care in those 30 days than they could in 6 months, a year of outpatient care, really to help them jumpstart their life, to get them going on the path that they need to go.
Now, what could one expect to see from a loved one following treatment? Would their quality of life increase significantly?
One of the things that we found in people that have come to us is that when they leave our program, they'll call us, they'll email us, they'll let us know that we provided a foundation, a firm, concrete foundation where they can stand in their lives and they can continue to grow. Too often in our lives, the pace of the environment is such that we lose our footing. We stumble, we fall. We can't get over those obstacles that are getting in our life. At Bridges to Recovery, what we provide is we provide a foundation and a support, a community where people grow and they change.